because we like to know exactly how these things work and impact our practices, as veterinarians they want to see the proof. So we've asked Dr. Kent Greer from Orlando, Florida to join us and give us some more information on how the VOM technology has worked in his practice, both to benefit the patients, the clients obviously, but also from the financial aspect. So thank you for joining us, Dr. Greer.
You're welcome. I'm glad to share my experience with you.
So just briefly, how long have you been practicing VOM technology?
It's been at least 13 years. It may even be longer. I've been doing it for so long, it's just a mainstay of my practice.
And in that time, roughly how many cases would you have seen?
I don't know. I see several a week that we start, and I'm guessing that over that 13 years we've probably done 1,000 cases or more.
And when those people come to you, are they always your own clients, or are they new clients trying to find a different answer to a problem that's existed?
Well, we have clients that come in with standard musculoskeletal problems that we deal with routinely. But also, I would say that a third of them or more, maybe even half of them, come to us by word of mouth referral, or they see our Facebook or our internet post or website that listed these alternative therapies, and they come looking for different answers other than surgery and medication.
So when this works, is that something where you're obviously going to make money out of charging for the VOM technology, but is that an ongoing financial benefit? Are they going to stay with you because you worked a miracle cure?
Well, some of them do. I mean, some of them, we have people that come for the therapy that drive an hour one way, so they have a 2-hour investment just to get to me to treat their pet. And so when the pet's better, they rationally would go back to routine care back at their own practice. However, we have some of those people actually keep coming to us just for routine care because they engendered a trust with us over the care of their other pets because of the VOM.
Now, there are going to be a lot of people out there that are referred for back surgery that decide not to do it, but they come to you.
Mm-hmm.
And when you work this cure and the dog's walking again, is that something that they are, obviously they're happy about it, but do they get mad that maybe they didn't need to spend the tens of thousands of dollars?
Well, in those cases they're usually pretty distraught because they've been given an estimate for many thousands of dollars to treat their pet, and we're offering it. They come looking for other answers. We're usually the last stop either before the euthanasia of the pet or before they spend the tens of thousands or whatever the money is for the surgery. And we're able to give them some hope. And in most cases, we're very successful with them.
Last quick question. Can you imagine your practices, I know you have 3 busy practices in Florida, can you imagine not having the VOM technology now? If someone was to come in there and say, sorry, you can't do that anymore.
It would be a huge loss. I mean, if I never knew about it, I'd be doing everything the way they taught me to in school, and I'd be perfectly like, well, that's the best you can do, refer them for surgery, and I did the best I can. But I know better now, and I just could not imagine not practicing with this. It is a strong arm of my practice that I use daily.
Thank you.